Welcome back to our series on colloidal gold lateral flow immunoassay technology. In our previous video, we discussed the basic principles and components of this diagnostic tool. In this video, we will be discussing some of the most significant applications of colloidal gold lateral flow immunoassays, exploring their impact, limitations, and future prospects. Let's use the COVID-19 antigen test kit as an example to illustrate how colloidal gold immunoassay technology detects antibody-antigen reactions. In this case, colloidal gold is used as a signal-generating label to visualize the presence of the SARS-CoV-2 virus antibodies in the sample. Here are the steps of the testing principle for the COVID-19 antigen test kit: sample collection, preparation, and loading. A sample is collected from the patient, usually in the form of a nasal or throat swab. The collected sample is mixed with a buffer solution to release the SARS-CoV-2 virus antigens, if present, and facilitate their detection. The prepared sample is added to the sample pad of the test strip, where it begins to flow through the strip via capillary action. Antigen-antibody conjugates. As the sample fluid flows through the conjugate pad, it encounters colloidal gold-labeled anti-SARS-CoV-2 antibodies. If the virus antigen is present, the colloidal gold-labeled antibodies will bind to it, forming an antigen-antibody complex. SARS-CoV-2 antibody detection. The sample continues to flow along the test strip until it reaches the test line, which contains immobilized anti-SARS-CoV-2 antibodies. If the antigen-antibody complex is present, it will be captured by these immobilized anti-human IgG-IgM antibodies on the membrane, forming visible lines. The accumulation of colloidal gold particles creates a visible color change, typically red or purple, indicating a positive result. The intensity of the color is often proportional to the concentration of the target molecules in the sample, providing semi-quantitative information about the presence of the target molecules. Control line. The sample continues to flow further along the strip and reaches the control line, which contains immobilized antibodies that capture any remaining colloidal gold-labeled antibodies. The immobilized antibodies at the control line are chosen for their ability to specifically recognize and bind to a particular region or epitope on the labeled antibodies. This epitope is different from the one that the labeled antibodies use to bind to the targeted SARS-CoV-2 antigen. This ensures that the test is working properly and serves as an internal quality control. A visible control line should always appear, regardless of whether the test result is positive or negative. Interpretation of results. Two visible lines signal a positive SARS-CoV-2 antigen test. One control line means negative. If no control line, the test is invalid and must be repeated. Colloidal gold lateral flow immunoassays have found widespread use in clinical diagnosis due to their simplicity, rapid results, and ease of use. Some key applications include infectious disease testing. Lateral flow immunoassays are widely used for the rapid detection of various infectious diseases, such as COVID, influenza, HIV, hepatitis B and C, dengue fever, and malaria. Pregnancy and fertility testing. Home pregnancy tests and ovulation predictor kits use lateral flow immunoassays to detect hormones like human chorionic gonadotropin, HCG, and luteinizing hormone, LH, in urine samples. Cardiac marker detection. Lateral flow immunoassays can be used to quickly detect specific cardiac biomarkers like troponin, myoglobin, and B-type natriuretic peptide, BNP, in blood samples, which can help diagnose and manage conditions like myocardial infarction, heart attack, and heart failure. Cancer biomarker detection. Lateral flow immunoassays can detect specific cancer biomarkers, such as prostate-specific antigen, PSA, for prostate cancer, and alpha-fetoprotein, AFP, for liver cancer, which can aid in early detection and monitoring of these diseases. These are just a few examples of the many clinical diagnostic applications of colloidal gold lateral flow immunoassays. These tests provide a rapid, cost-effective, and user-friendly way to obtain diagnostic information in various settings, from clinical laboratories to point-of-care and home testing environments. There are many products on the market that use colloidal gold lateral flow immunoassay technology, including COVID-19 Antigen Rapid Test Kit. There are several COVID-19 antigen rapid test kits available in the market from different manufacturers. Some examples of popular COVID-19 antigen rapid test kits are the FlowFlex COVID-19 Antigen Home Test from FlowFlex, from PanBio COVID-19 AG Rapid Test Device from Abbott, and the Sophia SARS Antigen FIA from Colloidal Corporation. Clearview Complete HIV Alpha Antibody Test. This test is used for the qualitative detection of antibodies to HIV-1 and HIV-2 in human serum, plasma, or whole blood. It uses a colloidal gold-labeled recombinant HIV-1 HIV-2 antigen for the detection of HIV antibodies. QuickVue Influenza A/B test. This test is used for the rapid detection of influenza type A and type B viruses in human nasal swabs or nasopharyngeal swabs. It uses colloidal gold-labeled antibodies for the detection of the viral antigens. Multi-drug rapid test panel. This test is used for the simultaneous detection of multiple drugs of abuse in human urine samples. It uses colloidal gold-labeled antibodies for the detection of the drug metabolites. Strep rapid test kit. This test is used for the rapid detection of group A streptococcal antigen in human throat swabs. It uses colloidal gold-labeled antibodies for the detection of the bacterial antigen. These are just a few examples, as there are many different types of lateral flow immunoassay test kits available that use colloidal gold technology.
Colloidal gold lateral flow immunoassay technology has several distinct advantages and disadvantages, many of which stem from the unique characteristics of colloidal gold. Advantages: visualization. The vivid red color of colloidal gold particles allows for easy visualization of the test result without the need for specialized equipment. Stability. Colloidal gold particles are chemically stable, enabling long shelf life of the test kits. Conjugation. The surface of colloidal gold particles can be easily conjugated with antibodies or antigens, facilitating the design of specific and sensitive assays. Versatility. The technology can be adapted for the detection of various antigens, antibodies, or other biological markers, making it highly versatile.
Rapid results. Colloidal gold lateral flow immunoassays typically provide results within minutes, which is critical in time-sensitive situations, point of care. These tests can be performed outside of a laboratory setting, increasing accessibility and reducing the burden on healthcare systems. Disadvantages: sensitivity and specificity. While these tests are generally reliable, they may not be as sensitive or specific as other testing methods like PCR, leading to a risk of false positives or negatives. Quantification. The tests provide qualitative, yes/no, results and are not typically used for quantifying the amount of target molecule in the sample. The intensity of the color change can provide a semi-quantitative indication, but it is not as precise as other methods. Variation in results. The interpretation of results can be subjective, especially when the color change is faint. This might lead to variability in results between different observers. Limited detection window. These tests are most effective during the peak of infection when the antigen concentration is highest. They may not detect the virus in the early or late stages of infection. In conclusion, the colloidal gold lateral flow immunoassay technology has significantly contributed to the global effort in medical diagnostics. As research continues to advance, we can expect improved test performance, multiplex testing capabilities, integration with digital platforms, and new labeling materials and detection methods. Thank you for watching.